So we'll finish that topic first, and then we'll move on to the next part. So we studied in details as to how you will examine the patient. So once we finish all this, I'll give you a general idea as to how you can examine a patient in totality. But right now we were talking about the special examination in terms of the different srotasas, how to examine the srotasas. And last time we spoke about the Rasava srotas, where we studied as to what all questions you can ask. Now, this Rasava Srotas, as we have spoken multiple times, is an important Srotas because it is the first Srotas that is going to get affected as soon as any kind of ama formation happens in the body. Because the moment ama is formed, it is going to get mixed with the nutrient fluid and it is going to go into the circulation. And that circulation is going to happen via the Rasava Srotas. So the circulation of the nutrient fluid happens through the Rasavasrotas. So as soon as the ama is formed, the nutrient fluid itself is mixed with the ama, and hence the Srotas disturbance will start immediately or can be seen immediately in these cases as when we see that the ama is present. We have also said that more than 95% of the diseases, they happen because of the Agni weaknesses. Okay. So now, when we say that 95% of the diseases happen because of the Agni weaknesses, do we mean to say that when the Agni is disturbed, ama is formed, so 95% of the diseases have ama situation or ama condition in them? A lot of people, when I speak to a lot of people have always mentioned or maintained that armor formation is a very integral part of the disease process, and they think rather that every situation there is armor present in the body. Now, when we understand the functioning of the Agni, and when we understand that the Agni disturbance causes the diseases, uh, I agree that you know maybe a small quantity of ama is going to be formed in the body, because obviously when the Agni is disturbed and the food is half digested, then the situation is going to be where there will be ama formation in the body. Will these will this ama cause immediate or will show immediate signs and symptoms on the body? Maybe not. So you may not always see that there is a presence of ama in the body through the signs and symptoms, but there is a likelihood that there is ama present in the body, because when the Agni is disturbed, the first thing that happens is the food gets half digested, and the half digested food itself is called as ama. And this is the reason why, whenever there is a problem with the Agni, we always have to consider the presence of ama and accordingly try and treat the condition. And that is the reason why the first line of treatment has always been said as Deepana and Pachana. What is Deepana? Stimulating the Agni. Pachana is digesting the ama or digesting the half digested food. If you have to consider it in a different language or different terms, Deepana is stimulating the Agni and Pachana is supporting the digestion, helping the digestion to do what? To complete the digestive processes. Now, when we say that completing the digestive process, which means what? It is going to help the body to digest the food that it has left half digested, which means that it is going to help the body to get rid of the half digested food, which also we refer to as ama. So whenever we are looking at Agni as the problem or Agni as the culprit, or whenever we say that 95% of the diseases, Agni Mandya or disturbance of the Agni is the cause behind these diseases, even though we may not actively say that, oh, there is ama presence or whether there is absence of ama, Directly, indirectly, we are always will be dealing with ama to a certain extent. And that is the reason I was mentioning this, that the line of treatment itself shows you that it is Deepan Pachan. You may not do specific things like, Langhana, which is mentioned for, um, digesting the ama, but even a simple process like Deepan Pachana is also directed towards digesting small quantities of half digested food remaining in the body, which is small quantities of ama remaining in the body or present in the body. And the reason I'm saying this is because Rasava Srotas is the Srotas which will immediately start getting affected. The first Srotas in the line or the first Srotas in which the nutrient fluid mixes or the ama mixes is Rasava Srotas. And hence, consideration to the Rasava Srotas, how the Rasava Srotas is, whether the Rasava Srotas is affected, etc., you will always will be important in the general understanding of the patient. So study this Srotas correctly, understand the factors, understand the pointers that we have to look at while studying this Srotas or examining this Srotas, and then always examine it properly, because you will find in a lot of cases this Srotas is affected or will show some or the other signs of disturbances. Now, when we look at the next Srotas, which is the Raktava Srotas. Now, the Raktava Srotas is also critical in understanding, because it is always said that the Rasa and the Rakta, they are moving together. The Rasa and Rakta, they are moving together. So Rasa Rakta, they are together. Now, which are the signs and symptoms that you study when we study the um, patient? So Tila Kalaka, which means pigmentation and moles. So, moles, pigmentation coming on the skin or suddenly appearing on the skin is an indicator that there is a chance of Raktava Srotas disturbance. Do we ever even think of this? I mean, how we must have seen on our bodies as well, because I do think that there are a lot of Pitta constitution people sitting here. Yeah. Uh, and when we look at a Pitta constitution person, obviously the chances of Rakta disturbance in a Pitta constitution person are relatively high. Why? Because the constitution is Pitta. The moment we start eating or consuming food substances which are Pitta aggravating, or we get exposed to positive factors which cause Pitta aggravation, they are going to start causing disturbances or with the liver, and then in turn it's going to cause disturbances with the blood. Have we seen changes in terms of moles and pigmentation happening on the body? I have seen a lot of times that people do not even realize that, oh, there are more moles on my body now than they were. There are more pigments on my body than they were earlier. So those are very simple signs and symptoms which will show up on the body in terms of some kind of disturbance with the Rakta Dhatu or the Rakta Vasrotas. So that is the first thing you will ask the patient. Have you seen that the moles pigments have increased recently, or have you noticed that they have increased on your body? The patient will tell you that, yeah, recently I've been observing that there are lots of moles appearing on my body. So that is an indicator. You will also ask like skin diseases. Now, it can be a specific skin disease, like maybe inflammation, maybe urticaria, like itching, maybe eczema, some kind of skin eruptions, etc. Or it can be as simple as the color of the skin changing. Yes, Dory?
Talking about moles, then you cannot remove it, isn't it?
No, we cannot remove it. You
Okay.
can, you can correct it by purifying the blood.
If there is a special color that will be related to it, or it's just any type of?
Just. So the moment you start correcting the liver, you start purifying the blood, you start using bitter substances which will purify the blood, improve the liver functioning, the the skin complexion or the moles also will disappear.
So what is it a mold formed of? If it's then is it blood? Like then
It's
purified
blood.
blood?
It's blood.
Oh,
It's basically blood. That's why I said that the first thing and the simplest thing which we never even notice is increase in the number of moles. I mean, it happens so commonly. On your hand you will observe, oh, there were 3 4 moles and now there are more moles on my skin. What is that indicating? That is indicating some change in the quality of blood in the body.
and if this is not being treated, will it lead to like a cancer or like can be lead to bigger disease?
So it's a interesting question, and I have always said that um, what will a small starting point lead to? You cannot tell today. If if suppose the blood disturbance starts in the body, okay, and you do not correct it, it just continues. It will lead to the blood becoming of a bad quality. It may lead to skin diseases. It may lead to liver being disturbed. It may lead to your digestive system being disturbed. It may lead to toxins being formed in the body. So, what will happen in your body from a starting point? Like for example, in this case, it's basically as simple as uh, moles appearing on the skin. Yeah. So whether it will lead to reflux and digestive system problems, whether it will lead to skin disease, whether it will lead to some liver disease, we cannot tell today. Why? Because how will the disease or how will the disturbance progress in the body is difficult to tell. What we have said that the doshas aggravate and the doshas will then go and attack the weak system and the weak organ. Now, we don't know what is your weak system, weak organ. So depending on what is the weak system or the weak organ, the doshas will go and affect that and will cause the disease there. Is there a question? Anyone's asking a question?
No, I was just saying even if it's just as you said, it's just a mole or something, but it's a start. So if we don't do anything, it will lead to something. We don't know what will, but it will be because the blood is entering.
See, uh, uh, when there is a short circuit and the entire house catches fire, it always starts with a spark, right? So that spark can destroy the entire house. So that is exactly what happens, and that is why this whole science is very different because it gives you a very different insight into your body. What we neglect today, what we ignore today, we don't know what it is going to cause in your body tomorrow, or maybe 3 months later, or maybe 3 years later, or maybe 30 years later. So the emphasis is on if you see something is wrong in your body, you need to correct it.
As for liver,
Sorry.
I would like you to tell me if it's correct that a liver renew every, I think it's every 6 months, means like if we do a big detox, we can have like a fresh new liver within 6 months.
So if you do detox, if you cleanse the liver, you know what you're doing is you're improving the quality of, you're improving the physiology of the liver. That's number one. Secondly, there are certain herbs, there are certain plants which have been proven scientifically to have, which have the capacity to regenerate the liver cells. Okay, one of the most important herbs which has been scientifically found to have that capacity is aloe vera. So it will renew the cells, or if the cells are damaged, it will repair those cells. It will correct the damage to the cells. But when we talk about Raktavasrotas, liver is its main organ, and liver is the starting point. And that is what I had explained in my lecture also, which I had asked you to read. That liver is the most important, one of the most important organs in the body. We emphasize a lot on our heart, we emphasize a lot on our brain, but liver is important because it is something that is constantly detoxifying your body. It is keeping your body clean. Whatever you are putting inside your body, whatever toxins you are exposed to, liver is doing the constant job of cleaning it and throwing it out. Simultaneously, whatever toxins are being created in your body also, they are also being cleaned by liver. So whatever impurities are there in your blood, that is being corrected by your liver. And I mean, I can vouch for it because I have personally, experienced this as to how a liver disturbance or how a blood disturbance can completely change the skin coloration, completely change the condition, and how immediately it can cause health problems. I don't know whether I have given you this example or not earlier, but um, when I was in my second year of doing my Ayurveda studies, and I ended up having enteric fever, which is typhoid, and obviously because I had very severe fever and I had very bad uh, digestive problems at that time, I was given a lot of antibiotics. Okay. And when I took those antibiotics, they were very strong antibiotics, which I had to be given. And the duration for which I was given those antibiotics was also pretty long. And when I recovered from that enteric fever and I started going back to the school, everybody started asking me, what is wrong with your skin? Why you are looking so dark? Why your skin is looking black? Why you have. So obviously people weren't saying that your skin is looking unhealthy or your skin is looking black. They were saying, oh, it looks as if you're tanned, your skin is looking darker. I didn't realize it because you watch yourself every day and you don't realize the change. But everybody practically was coming and telling me this. And a couple of days later, I ended up having herpes, which is basically a condition related to disturbed blood. And when I had herpes and then I treated that, which was treated with, because it was diagnosed as a kapha dominant herpes, but mainly herpes itself is a condition of Rakta Dhatu. I was administered emesis as well as I was given a lot of purgation and a lot of bloodletting was done. Now, when the bloodletting was done, I could see that the blood which they had diagnosed that, it is a condition predominantly because of disturbance with the kapha dosha. I could see that the blood was thick, stringy. It was sticking to the kidney tray. It was not as if it was what you can say, coagulated. When it came down in the kidney tray um, from the blood vessel straight, it was as if it was coagulated. It was clotted. So I could clearly see the signs and symptoms of kapha in it. Obviously, I didn't understand, but the Ayurvedic doctor who was treating me, he was explaining me because I was being a student. He was telling me, look at the quality of blood, how it is. This is how kapha blood looks, etc., etc. So I was clearly seeing that. And when my treatment was done and I was given bloodletting a couple of times and I was given emesis and purgation, the skin color completely changed. And obviously, I was put on some bitter tasting ghees, which I consumed with rice for a couple of months, like a month or 2 months, and which also cleans the liver. So the skin color changed, herpes got cured, all that happened. So probably, you never realize that how toxins can cause disturbances with your liver. I mean, I'm saying antibiotic as a toxin because it is hepatotoxic. Most of the antibiotics that are consumed, they are toxic to the liver because the liver has to clean them and eliminate or excrete them out of the body. So they are toxic in nature, and that is what happened. But the point that I'm trying to make is that, a small situation or a small condition that can start, something will happen, you take something, and then it will lead to something else. And like we said, that a small starting point of having increased number of moles on the skin can then lead to any condition in the body. Like you said, it can be a chronic skin disease, or it can be, as bad as maybe cancer, who knows. So paying importance to the changes happening in your body and treating them in time is extremely critical. When we look at the genetic science of today, and when we look at the genomics, and when we talk about that, what is it telling you? It is, end of the day, it is telling you that, you know say for example, you do your genetic testing and you find out that you have a gene for cancer. Now, if suppose you find that out, that you have a gene for cancer, then obviously your effort is going to be what? You're going to have a lifestyle, you're going to have a diet which will prevent that gene from expressing. Now, if you're going to prevent that gene from expressing, how are you going to do that? You will have to do it by maintaining a healthy liver, by maintaining good quality blood, by maintaining a condition which is without the armor formation in the body. That is what is going to be critical. And that is why eating clean, eating healthy, keeping your digestive system healthy is going to be critical. So when we understand the science of genomics today, what does it tell you? It tells you the possible weakness that exists in your body. It tells you the possible weakness that exists in your body. What does the science say? It says that this is possible in your body, or this condition is possible in your body. There is a gene for obesity. It will tell you that, oh, there is a tendency of obesity in your body. There is a gene for diabetes. Okay, so it will tell you that there is a possibility of you having diabetes. Now, once we know that, then what is our role? Our role is going to be, once we understand how diabetes happens, how obesity happens, then obviously we will go back and see that the lifestyle and the diet are such that we don't give the chance to the body to get into that situation, to get into that zone where that gene expresses, that weakness expresses, and the disease is formed. But what I feel is that when we study the genetic science and we come to know about the genomics and the possible gene that exists in your body, you can actually do something better than just prevention, the way today's science tells. What you can do, you can actually start a rasayan therapy for that particular organ or for that particular system and improve the quality of that. So if suppose they are saying that you have a gene for diabetes or obesity, that is a condition related to Meda Dhatu. So why, if we start Rasayan for Meda Dhatu, then we are correcting the weakness for that. If suppose there is a tendency for cancers, they will indicate specific cancers. Oh, you have a tendency for, or you have a gene which is for cervical cancer. You have a gene for blood cancer, which means that they are telling you that there is a possible weakness in the Rakta Dhatu or possible weakness in the Shukra Dhatu. If that is the case, then we can do the Rasayan therapy and improve the quality of that tissue. And then not only will we prevent any expression, which we will also possibly remove the predisposition that exists in the body. So we can actually combine the modern science that is telling you something today and use it with the Ayurvedic concepts in a better way for improving health and wellness. Coming back to this, so moles as a simple situation, skin diseases, you can also check whether the person has any skin diseases. Now, any kind of skin disease, whether there is itching, whether there is eczema, whether there are skin patches, whether there is skin eruptions, whether there are acne, psoriasis, any kind of skin disease is basically an indicator that the blood is disturbed, the Raktavasrotas is disturbed. No skin disease can happen without the disturbance or without the involvement of liver and the Raktavasrotas. Always remember that. So whenever you see any skin disease, whenever you see any skin condition, the first thing that has to come to your mind is check how is the Raktavasrotas, check how is the quality of Raktadhatu, check how is the liver functioning. If you look at these three things, you will be able to correct the skin disease in most of the cases. And when we go back and look at the causative factors, say particularly for skin diseases, you will always find that there will be causative factors which are primarily causative factors causing disturbances with the blood and disturbances with the liver. So foods that are toxic in nature, now when I say foods that are toxic in nature, how Ayurveda has explained the concept of toxic foods?
I think you mentioned that everything is toxic. It depends on the amount you have in it.
Yeah, so everything is toxic based on the amount. But what is there a concept of toxic foods or foods which will cause toxic effects in the body?
The Viruddhara, the wrong combination.
Viruddhahar, exactly. Viruddhahar, the incompatible foods. That is exactly the concept of toxic foods. The foods that will cause disturbances in the blood, disturbances in the rakta will be toxic once they are consumed. So Viruddhahar concept is extremely important. Now, what is Viruddhahar? If we have to understand what is Viruddhahar. Incompatible foods. What are incompatible foods?
Combination that together disturb the agni.
No.
Combination of food that together they disturb the body, like or having, or they become toxic if you take, I don't know, milk and fruit. You can like milk is good for the body, fruit is good for the body, but if you take it together, it's toxic for the body.
Correct. So foods that are maybe, they are beneficial for the body, but when they are mixed, combined in certain manner, they can become toxic in nature, or they can become poisonous once that combination goes inside the body. That is the concept of incompatibility. But the concept of incompatibility does not stop here. Okay, it is not as limited as, having dairy and fruits, like acidic fruits with milk, or it is not as simple as having heating the honey and consuming it, or having fish and the dairy. It is not as limited as this. The concept of incompatibility. What is the meaning of the word incompatible?
They are not compatible. Happy together.
Sorry,
No, happy together.
not happy together. Correct. So compatible. That's the easiest way you can explain from a practical life point of view. Not happy together. So incompatible basically is something that cannot be together. Okay, that cannot combine together. That cannot uh, you know come together. So when we look at this concept of being not happy together, this concept goes beyond just the concept that we spoke just now. So let's look at, say, constitutions. Okay, Vata, Pitta, and Kapha constitution. Now, there will be foods which will naturally be incompatible to these constitutions. Will there be foods? What will be those?
Spicy for pizza.
Correct. So if a Pitta constitution person consumes extremely spicy foods, that is incompatible as per the constitution. If the Pitta constitution person consumes a lot of hot foods, hot as in temperature wise hot, that is incompatible as per the Pitta. Eating lots of sour, salty, pungent foods, that is incompatible as per the constitution. Eating excessive amounts of fermented foods, that is incompatible as per the constitution. So the concept of incompatibility does not remain restricted to dairy and fruit, fish and dairy, etc. It goes beyond that, and it starts once you start understanding. Imagine a Pitta constitution person consuming fermented foods, having miso soup every day. That is obviously going to be incompatible for that person. That is going to cause serious disturbances with the liver and the Rakta Dhatu. If a Pitta constitution person starts eating extremely spicy food, that is incompatible. It may not show adverse effects maybe in a day or two, or maybe in a day or two also. But if the person continues eating that, those foods eventually will act like incompatible foods and will cause problems to that person. Similarly, if a Pitta constitution person works in extreme heat, that is incompatible. If the Pitta constitution person, high Pitta constitution person is working as a chef in a hot kitchen, that is incompatible. So the concept of incompatibility goes beyond just the foods. It goes into your lifestyle. It goes into, your normal food also that you're consuming, which are not classically labeled as incompatible, but they become incompatible based on your constitution. they can become incompatible based on the season that you are in. Imagine a Pitta constitution person with the rainy season where already the Pitta is aggravated because of the Amla rasa in the environment, and you consume foods which are Pitta aggravating. So constitution plus the nature plus the food, everything is coming together to create problems. Imagine a Vata constitution person in a dry weather, cold weather, exposed to Vata aggravating factors. So the concept of incompatibility has to be understood just beyond the concept of incompatibility that you have studied. And then things start making more sense to you, because then the moment you say incompatibility, you will start thinking beyond that, oh, if this person is Kapha constitution person, then consuming excess amounts of fats is incompatible for him because that is not suited for his body. A Kapha constitution person having a sedentary lifestyle is incompatible because that is not suited for his constitution. A Kapha constitution person sleeping during the daytime, incompatible. Pitta constitution person sleeping during the daytime, incompatible. So, incompatibility plays a massive role in skin disease formation. We started talking about incompatibility. Why we were referring it to the skin diseases. Whenever you are studying any skin disease, or whenever you examine a patient and you see there is a skin disease, the first thing that has to come to your mind is what is this person consuming or is getting exposed to which is incompatible for him. A simple thing like a Pitta constitution person working in heat or working in sunlight or working in hot environment, drinking ice cold water. Pitta constitution person working in extreme heat, extreme sunlight, drinking ice cold water is incompatible because this is use of opposites. Hot and cold being used alternatively. And you will find these kind of positive factors in people constantly when you start examining them. So whenever you see skin disease, yes, Rekha, welcome back.
Thank you. I was wondering, so in this scenario that you put, Pitta person working on the heat, for example, and then it's incompatible with cold water, but wouldn't it be worse if she had hot water because this will even increase the heat? Like, I mean, doesn't in this situation the water counterbalancing?
I never said that, a Pitta constitution person working in heat should drink hot water. The thing is that it is always suggested that when your body is extremely heated because of the heat or because of, you being exposed to heat, when you want to drink water, you come out of that environment, sit in a comfortable temperature first, let the body cool down a bit, and then drink water.
Okay. But
It
then,
is like, you heat a pan, and then you hold it below running cold water, it will crack. So the same way, the body will also react to it. But what will the crack be here? The crack will be your liver will get disturbed, your blood will get disturbed. In India, traditionally, it is always there that whenever guests come into your house, for example, the first thing we offer is a glass of water. But we don't offer them a glass of water immediately. It is understood that, sit for 5 minutes, cool down, and then have water. Because we don't want the blood to be disturbed, the rakta to be disturbed, the liver to be disturbed. Clear?
Clear.
Yeah. So skin disease is always the moment, and the what I'm trying to tell you. Yes, we had Pedro.
Yeah, I have a question. Maybe silly, I don't know. But for example, what happens if someone has like an injury on the skin? The liver ends up affected because it has like to be working. I don't know. You fall from the bike and you have like a massive injury on your arm, and you're like all your body have to be working to repair that. Your liver will end up affected.
So just let me understand the question correctly. Are you saying that if there is an injury, a physical trauma, will that cause disturbance with the liver? Is that the question?
Yeah.
Okay. So interestingly, physical trauma has been given as one of the causative factors for the disturbances of the blood. Okay. But will that happen always? Like, for example, you cut your finger while cutting, say, onions or tomatoes in the kitchen. Will that immediately cause disturbance with the blood? No. What you have to read in between the lines is that if that wound gets infected, for example, then what happens? Then your blood is obviously disturbed, right? So infection, because there is a trauma, because the wound is exposed or the blood is exposed, if that gets infected, then your blood will get disturbed, then your liver will get disturbed. Okay. So that is something which is to be understood when we say that if there is a trauma, or the Ayurvedic books also say that physical trauma, physical injury is one of the causes of blood disturbance. But it is not in all the cases. It is when you have physical trauma and there is infection, then it will be the disturbance of the blood or the disturbance with the liver. Yes, Francesca.
There is a reason why, for example, talking about skin eruption or eczema, etc., they come in a different place. For example, some people have it in the hand, some people have it in the arms or in the face or in other parts of the body. If the reason is always the same, like the blood affected and the liver function affected, why they are in a different place? What can wait for?
So, so every disease, okay, they have given certain areas where it will happen. Okay, even though we call it skin diseases, okay, even though it is called as skin diseases are also labeled differently. Like, for example, if we say acne, pimples, there's a location given for it. Yeah. Why? Because it is a skin disease which is of eruption, which will happen in particular areas, which we call as a particular disease. So rather than me saying what the question that you asked, that when we say skin disease, why does it happen in particular areas? It is obviously to do with the probably the disturbance of the blood in that area, particularly localized disturbances which may happen in particular areas, or it is the condition that happens in a particular area has been named as something. Like, for example, if there is an eruption on the skin, which happens, say, around your stomach or around your chest or around your head, which spreads, which are of a particular nature, then that is called as herpes. So the underlying cause is the same, which is the skin disturbance, sorry, the Rakta Dhatu disturbance, the liver disturbance, but it will present differently depending on where it is presenting with different signs and symptoms, and then it will be called differently. But if we look at the explanation given in the Ayurvedic textbooks, it is given under one condition only, which is called as skin diseases. And then there are, 20, 30, 40 skin diseases explained, but the line of treatment more or less for all these diseases is the same.
The area of the body, because the blood is more affected in this area.
In that area, probably.
How can the blood can be affected just in one?
And that is why whenever skin diseases, we treat the skin diseases, we also do localized leech application on that particular area. Like for example, if there are acnes or if there is any skin eruption, say on the arm, then we will directly do a leech application on the arm where there is disturbed blood causing the condition.
But if the blood like circulate all the time, how can be affected just in one area or more in one area than the other?
But it is still it is doing its function, right? What is the function of blood? It carries Brajak Pitta through it. What is Brajak Pitta doing? Brajak Pitta is the Pitta which is responsible for the quality of the skin, the complexion of the skin, the health of the skin. So if your Brajak Pitta is affected in particular area, then it is going to cause problems in that particular area.
Okay.
So, and that is why the treatment is also done. I'll come back to you, Doreen. Give me a minute. The treatment will also be done on that particular area only. Like one thing is when we apply leeches, okay, leeches are understood that leeches will only absorb blood from the disturbed area only, or leeches are meant to absorb only impure quality blood. Okay, so when we apply a leech on a particular area which is affected or which has any skin condition, when the leech is applied, the person who is suffering from that condition does not even feel the leech absorbing the blood. Why? Because the blood is disturbed and the disturbed blood is being sucked by the leech, and you do not feel any pain, burning sensation, etc. But the moment the impure blood from that area is absorbed by the leech, licked by the leech or sucked by the leech, and it starts sucking pure blood, immediately the person will start experiencing pain, burning sensation in that area. And that is one of the indicators which has been given in the textbooks, that the moment the person says that I feel pain or burning sensation, it's time to remove the leech, because we do not want the leech to keep on sucking the pure blood. Most of the times the leech itself will leave the infected site. But if the leech doesn't leave, then we have to remove the leech from that area, because we do not want the leech to continue sucking the pure blood also. So it's a clear indicator that there was impure blood in that area, which has been now, removed by the leech. And that is why the patient will also tell you that I'm experiencing pain, tingling, burning sensation in that area where the leech has been applied and is sucking the blood.
Can be also more emotional reason, also the area, or
Meaning?
like for example, can be also emotional reason why is an area instead of the other, and not just because it's the blood.
I'm not sure about it. I mean, I'll have to
Oh.
study more. Yeah.
Oh.
Yeah.
Thank you.
Yes, Doreen.
Can we link? So her question to a specific area maybe it's not Ayurvedic, but can we link that to the meridian that if it's, for example, you mentioned the face, if it's on some part of the forehead or some part, this will lead to certain organ. Can we link that, or is it just a no in Ayurveda?
I'm not sure about it because the meridian concept, the concept of nadis exists in Ayurveda, but not so elaborately explained as to, um, how it impacts, how it affects the functioning, etc. The energy lines or the energy meridians have been explained, which are mainly related to the energies. I'm not sure about, you know, its relationship with the dhatu directly, physical thing.
Yeah, this is more Chinese medicine, though.
It is Chinese, yeah. But there is a concept of nadi in Ayurveda also, which explains meridians also. Not explained in details, very briefly mentioned, but the mention is there. I mean,
Can
no,
I give a small example?
sorry.
Can I give you a small example?
Yes, please.
So, because I have a little knowledge of Chinese meridians, I find out that a pain on my toe is linked with it's touching liver and stomach meridians. So I've done
Okay.
a lot of things.
Can you repeat, sorry?
So I was saying, on my own thing, I have a pain on the toe that touch liver and stomach meridians. This I found out later. Since I work on that, it's better, but every time I get angry, right, which is, stomach, liver, pitta, the pain is back. Which is a toe, right? It's not the same area. And I make a link of organs and issues in the body locations.
Okay, interesting. Maybe, can be studied and linked together. Yeah. Okay, can we proceed? Okay. So we spoke about two conditions for Raktavasrotas, that what do you examine for. Then also ask for whether the person has more desire for cold substances, desire for sour substances. This is also important because normally people, when there is Rakta Dhatu disturbance, Raktavasrotas disturbance, desire for cold substances increases, desire for sour substances increases. That is what we have studied when we were talking earlier. Then dryness of the skin, etc. What is important here to understand is, just like we studied the pigmentation, we studied the skin diseases, check whether the person has tendency of mouth ulcers. Okay, tendency of mouth ulcers, recurrent mouth ulcers, is an indicator that the person is likely having some disturbances with the Raktavasrotas, Rakta Dhatu. Okay, so ask for mouth ulcers. Another thing that you should ask for is whether the person has any condition of varicose veins. Okay, varicose veins, that is an indicator for, again, some kind of problems with the Raktavasrotas. What is varicose veins? We have talked about it earlier, that varicose veins are basically where the blood stagnates in the blood vessels, is not circulating, it accumulates and it stagnates. So that is possible only when there is some weakness with the Raktavasrotas, there is some weakness with the walls of the Raktavasrotas, and that is why always check for varicose veins. Also check for spider veins. Spider veins are thin veins that just start becoming visible on the body, particularly back of the knee or on the thighs. These are the areas, or on the calf. These are the areas where the spider veins will start appearing which is the beginning, which is an indicator or it's a sign of beginning of the disturbances with uh, the channels or the blood vessels. Yes, Doreen?
Varicose vein, you mentioned that it's the valve, so the blood doesn't go back up because of the valve is,
Yeah, so it is the problem related to the blood vessel wall, isn't it?
but if the valve doesn't, is it just Racta or will it be something else if the blood cannot come back up because of the quality of the wall? But the
So-
valve is supposed to do a job.
So basically the blood vessel walls, what is the blood vessel wall? What is the relation with Rakta Dhatu?
Yeah, second tissue.
Sorry?
Upadatu?
Upadhatu. So the blood vessels are the Upadhatu of the Rakta Dhatu itself. So if the Rakta Dhatu is not of a good quality, then obviously the blood vessels are also not going to be of a good quality. And that is how, the problems with the blood vessels will start. So going back to the lecture that I was giving, that I had asked you to listen to, where we had said that the fat or the lipids are not the problem. The blood vessel wall is the problem. Correct. Now, when we say that the blood vessel wall is the problem, then obviously blood vessel wall can only be problem when the blood also is a problem. When the blood quality disturbs, then the blood vessel wall quality will disturb. When the blood is affected by toxic substances, that is when the blood vessel wall will also become affected and will become weak, maybe not have the same strength, etc. So the causative factor is basically the Raktava Srotas and the Rakta Dhatu, which is going to cause problems with your blood vessel wall. And if the blood vessel wall is damaged, then there will be other problems that happen.
Can we repair a blood vessel wall that has cracked?
Which has
Cracked?
plaque. So, so basically, what is plaque? We have studied. Plaque is basically, the repair mechanism that has happened where the band-aid has been applied on the damaged wall. Correct. So what you have to do is you have to improve the quality of Rakta Dhatu, improve the quality of the blood vessel wall. If that is improved, then the plaque is also going to get corrected. Every cell has the capacity to regenerate, right? So what was damaged, something is helping you correct that at the moment. It is like a band-aid. Your lipids are helping, protecting, are repairing that damaged wall. The root cause is the damaged wall. If you improve the strength of the damaged wall, if you regenerate the cells, if you repair the cells, and the wall becomes healthy, then there is no need for the lipids to stick to it and act like a band-aid. In fact, the lipids don't stick to the walls if the wall is not damaged. That is what we have seen earlier. The lipids have no role to play of sticking to the walls if the wall is not damaged. So when we look at this situation, it is primarily the wall that is problematic than the lipids. So can we remove the plaque? 100% we can remove the plaque. Can we correct it? 100% we can correct it. What are those books which became very popular couple of decades ago, reversing the heart disease, etc., etc. We are talking. They were talking of a natural diet. They were talking of a clean diet. They were talking of high fiber diet. What was it doing? It was correcting the quality of blood. It was improving the quality of the blood. It was improving the quality of the blood vessel wall, and it was helping reversing the heart diseases. So end of the day, your diet is going to do that. Your diet is going to correct that. Your quality of tissues is going to do that. So that is the thing. So coming back to this, when we are studying the patient and when we are studying for the Rakta Dhatu, Rakta Vasrotas, blood vessel quality has to be checked. Recurrent mouth ulcerations have to be checked. Skin diseases have to be checked. Pigmentations have to be checked. So these are basically, couple of things that you will check. Apart from that, in cases of females, you will check the menstruation, because that is a direct indicator of how the blood quality is. The menstrual quality will get disturbed immediately. If the vata disturbs the blood, then the menstrual quality will change. If the pitta disturbs the blood, the menstrual quality will change. The kapha disturbs the blood, the menstrual quality will change. So understanding of menstruation is also important as a specific situation in females, which will also give you some indicators as to how the Rakta Dhatu or the Rakta Vasrotas is. Yes, Dory?
Okay, so for menstruation, how would you differ the type of question you will seek if it's rasa or rakta? What will be the thing with the menstruation? If it's high pitta, will it be because it's very strong smell, or will it be in the nature, the color? What will it be?
So when we ask for menstruation, what do we ask for menstruation? What do we check?
If it's regular, then the flow and the
So
color.
first and foremost is regular, irregular, correct? Whether it is regular or irregular. So that is the first thing you'll ask. If it is irregular, that means what? Some kind of a vata problem exists. Irregularity can only happen because of vata, correct?
So it's rasa.
So you will understand that there is some vata disturbance there. Then when you ask for quantity, the quantity will give you an indication whether it is vata, pitta or kapha further. Less quantity is vata, more quantity is pitta. Then the color. The color more darker, more blackish color is more vata. More reddish, more strong red color is pitta. Strong smell is pitta. And associated signs and symptoms. Pain will be associated with vata, headaches, nausea, mood swings, irritability, loose motions, that will be associated with pitta. Kapha will give it signs and symptoms like heaviness in the body, wanting to sleep, depression. Those kind of signs and symptoms will be seen with kapha. So in general, when you observe, and also the nature of menstruation, kapha will also indicate clots. Kapha will be, stringy menstruation. So you can make out what dosha disturbance is there with the rasa and rakta with reference to the type of the kind of menstrual fluid, menstrual cycles they are, the type of menstrual fluid that is being thrown out. So all that will then indicate which disturbance, which dosha disturbance is there with the rasa and rakta. So coming back to the Raktavasrotas, important things you will ask for is increase in moles and pigmentation, any skin conditions that you are seeing, desire for cold and sour substances, increase in mouth ulcers, then also, I'll come back to you, Rekha, 1 minute. and increase in or are there any varicose veins, and you'll also understand whether there is any difference in the menstrual cycle, menstruation in cases of females. Yes, Rekha.
No, I was just waiting for you to, wondering the meaning of the Sanskrit symptoms that are on the right hand of the slide.
The English words.
No, the Sanskrit ones like Aruchi,
Yeah, yeah, yeah.
Shirashura,
Same thing.
Vidaha.
You want the, I didn't get you, sorry. You want
Well-
all of these to be explained to you, right?
Yeah, just wanted to know, but I
Yeah,
think we're
yeah, yeah.
about to do that, that's why I stopped.
Okay, okay. So desire for sour substance, this is fine. Twak rukshata, twak is skin, rukshata is dryness. Okay. Twak sphutana, twak means skin, sphutana is cracking or breaking.
Mhm.
Okay. Mukha paka, mukha means mouth, paka means ulceration, inflammation. Okay. Eye diseases is easy to understand. Agni mandya is easy to understand. Increased thirst, heaviness, weakness. Aruchi. Aruchi is, ruchi means taste. Means absence. Absence of taste, absence of understanding of taste. Shira shula. Shira means head. Shula means pain. So headaches.
Mhm.
Vidaha. Now vidaha means burning sensation. Okay, burning sensation in the chest, burning sensation in the stomach. So vidaha is also reflux. Tama pravesh. Tama means black, dark. Pravesh, entry. So dark appearance of dark circles in front of the eyes or suddenly feeling dizzy. That is what is tama pravesha. Pidaka. Pidaka means eruptions on the skin. And pradara means menstruation. Particularly, pradara refers to abnormal menstruation or problems with the menstruation. This word is particularly used when there are certain problems with the menstruation, then the word pradara is used. Otherwise, it will be called as artava. Okay. Then the next one is the Mausava Srotas. Now, examination of Mausava Srotas is relatively easier. In Mausava Srotas, you will primarily understand the quality of Mausa Dhatu. So, tone of Mausa Dhatu, quality of Mausa Dhatu, the quantity of Mausa Dhatu has to be understood first and foremost. And they have given here, for example, if you look at this, Griva Shushkata. Griva means neck. Yeah. Shushkata is dryness. Now, what is dryness of neck? Dryness of neck basically refers to that the neck region is not properly covered by muscles properly. It is it is lacking the musculature. So you can see all the, tendons, etc. very clearly. That is Griva Shushkata. Same is the case explained here. Uru Shushkata. Uru means thigh. Dryness of the thigh. So the musculature on the thighs is not developed properly, or loss of musculature on the thigh region. Sphika Shushkata. Sphik means buttocks, glutes. Shushkata is dryness. That is also reduced musculature or reduced less musculature on the glutes or the buttocks is what is expected here. So in general, when we see this, what it means, the quality of musculature has to be studied. Whether there has been loss of muscle tissue recently, whether there is, loss of musculature, the person has lost weight and has lost weight because of loss of muscle tissue, then that is some indication that there is a disturbance with the Mousevus rotus. That is first thing to study. Then Sandhi Vedana. Sandhi Vedana is, Sandhi means joints, Vedana means pain. So joint pain. So joint pain is basically an indicator of muscle problem. Now the joint is made up of bones, nerves, blood vessels, and muscles. A joint is made up of bones, nerves, blood vessels, and muscles. So Sandhi Vedana, joint problem, is always will be associated with the problem with the muscles always. Overall dryness in the body. Okay, it is difficult to understand Mousevus rotus disturbance just by dryness, but the dryness here can be referred to as what we said earlier, general emaciation or general loss of musculature on the whole body. That is what is the meaning of the word dryness in the body. Okay, it is not a simple dryness like, a skin dryness caused by excess water. This is dryness in the body, which is because of loss of weight, loss of musculature, emaciation caused by loss of musculature or, reduced quantity of the muscle tissue. Then toda means pain in the body. Toda means pain in the body. Now the word toda specifically refers to a type of pain where it is what do you say, pounding pain, as if somebody is hitting you. It's a pounding pain, which is toda. Then arbuda means some kind of growths. Arbuda means some kind of growths on the skin, on the muscles, on the body. Then Kilaka is a kind of a skin disease which is there, which also is indicator of some kind of growths on the skin. Okay. And Galaganda is basically enlargement of the glands in your neck region. So Mousevus rotus, when you are examining, always focus on understanding the quality of muscle tissue and check whether any joint pains are there, joint problems are there. That is an indicator that there is a problem with the Mousevus rotus. That is how you will examine the Mousevus rotus. Then Medavus rotus. What is the biggest indicator of disturbance of Medavus rotus? Obesity. Obesity is basically the biggest indicator of disturbance with Medavus rotus, and that is why I have not mentioned any sign and symptom that is mentioned here. Why? Because the moment we say Medavus rotus, you have to check for the tone of the body, the tone of the different parts of the body, the quantity of fats in the body. excessive sweating. Ask whether there is excessive sweating. Excessive sweating is an indicator that the Medhava Srotas is disturbed. So relatively easy to understand this Srotas, which is clearly seen by, increased fats in the body and increased sweating tendency in the body. And that is explained by Medhava Srotas. Then Astiva Srotas, though cracking of teeth, cracking of nails, hair loss, extra bones, etc. So if a person comes to you and says that, I have calcaneus growths in my feet, what is that? Calcaneus growth is basically extra growth of the bones. Calcaneus spurs, they are called as. What are those? Those are excess growth of the bones, which is what is explained by extra bones or extra teeth. When we read it, we may not understand it, but people come and complain that I have calcaneus spurs in my feet. What is that? That is extra bone, excess growth of bones or disturbance with the astiva srotas. When you are examining the person, always ask the person that, have you seen that there is increase in the dental cavities or cavities in your teeth? So cracking of teeth, person will not understand what is cracking of teeth. But what will happen? The tendency of cavities will increase. The person will explain, yeah, recently I had to go to the dentist more often because I found that I had more cavities than before. So ask for this specifically. Then cracking of nails. How will you ask the question? Are you able to grow the nails? There will be people who will say that I cannot grow the nails. They are very brittle. They break very easily. I cannot grow them beyond a certain size. You will also observe the nails by checking the nails physically. The nails will be very, very thin and very, very weak. That is an indicator that there is the astiva srotas is disturbed or the asti dhatu is disturbed. And hair loss. You can ask the person that, are you losing a lot of hair? That is also an indicator that the astiva srotas is disturbed. So these are 4 or 5 things, calcaneus spurs or calcaneus growths, increased tendency of cavities in the teeth, nails becoming brittle and breaking easily, cracking on the nails, like there are ridges on the nails. That's also an indicator of the nails becoming weak, and hair loss. So these are things that you will ask for in the patient for the astiva srotas.
Yes, go for it.
The videos, that was here. Manish, can you hear me or see me?
Yes, yes.
Okay. Excess growth of hair can be also problem related to astigmatism.
Sorry, excess.
Excess growth of hair can be also a problem related to astigmatism.
Yeah, so excess growth of hair, meaning what will happen is that like I mentioned earlier, you will always find that people, or I'll correct myself, I don't want to make a very generalized statement. You will find it quite often that people who have very long hair, okay, they will have a very petite body. Their bone structure will be smaller. Okay, their bone structure will be smaller. That's an indicator that the Asthi Dhatu, Agni, is stronger, which is causing the hair to grow longer, but the Asthi is not getting nourished.
But when I'm close to my period, I start to get like hair here. Is that for acid as well?
When, sorry, can you repeat the first part?
Because when I'm close to my period, I start to get the hair here. But this is just recently, like never been like this, just years ago. Is that also like, and my hair grow very fast? Like a problem or something that related with Astiva Hasota?
No, it's not asti. You need to get your hormones checked. No, I'm not joking. Okay. Basically, this is an indicator that the facial hair growth, particularly, is an indicator of increased testosterone in the body. Okay, and testosterone increase can happen when there is a condition which is like a polycystic ovary or polycystic PCOS, okay, or PCOD. So if you have painful menstruation, you have, if you have, um, if you're putting on weight, then you need to get this checked because that can be a starting point of PCOS, PCOD. Polycystic ovary. Because facial hair growth is a classic symptom of increased testosterone in the body. And this increased testosterone can then cause the ovaries to become polycystic, like, it causes cysts on the ovaries. And then it can lead to increased body weight, increased, your skin breaking out, your digestive system getting disturbed, etc., etc. So if you are observing this right now, I would say get your hormonal assay done. Okay. Free 5-minute consultation. That's called it.
Oh, and one for Mansa, is it twitching muscle as well? Will be a Mansa thing or just the Vata?
No, twitching of the muscle will not be really a disturbance with the Mausavasrotas. It will just be a Vata affecting the Mausadhatu. Increased movement of the muscles. That is what will be Vata disturbance of the muscle. Just like stopping of the movement will be also a Vata problem. Increased movement, which is twitching, will also be a Vata problem.
What about cramps? Cramps as well?
Sorry.
Cramps as well?
Cramps as well. Yes.
In Western medicine, mostly it's magnesium that will be suggested. What will be in Ayurveda? Will be something else or the same thing?
So primarily, you will look at the Rasadhatu in these cases when there are cramping. You look at the Rasadhatu, and you will also do application of oil and Vata pacification.
Thing like that, or even sesame.
So I am doing some work on this where these micronutrients which are there, which are minerals, etc. There is a lot of study that has gone into use of various minerals, micronutrients for various health conditions. Okay, so I am actually trying to I'm studying it for my personal interest, basically, where I'm trying to understand the correlationship between these micronutrients and the doshas, whether that is something that's related. And I'm also trying to understand whether the micronutrients that are suggested in the Western concept are similar to the minerals and metals which are used in Ayurveda. And can we substitute use of micronutrients instead of the minerals, metals? So then what happens is suddenly if there is a relationship, say for example, a particular disease is there and they say you can use say magnesium, okay, or you can use zinc. And Ayurveda also says that, oh, in this disease you can use zinc. Then that's an indicator that you can, instead of using the zinc, according to the Ayurvedic concept, which has a lot of limitations and restrictions, etc., in terms of availability, processing, etc., can we use micronutrients and correct the problem? Even if maybe we not be able to use correct it 100% the way Ayurveda expects, but even if we can achieve 80-90% results, still it's better. So I'm doing my own study on that. So hopefully I should be able to come out with something interesting or nothing, honestly, end of it. So I'm just hopeful. Yeah.
Cool.
Thank you.
Something, would you do us, or like, a workshop or something?
For
Would you share, at the end, would you share your research?
I am not sure whether I'll be able to finish it before you finish the classes with me.
Did you?
I'm not sure about it. Because your classes are supposed to, I mean, you got clinics going on, so maybe I'm not sure. If it's March and I'm able to finish something before March, I can, arrange something like a small talk or something with you guys. Okay, the next one is Majjava Srotas. Now, Majjava Srotas, when you are understanding Majjava Srotas, it is a slightly difficult Srotas to understand while examining the person. But mainly when we examine the person, you understand whether there are any psychological problems which are there with the person. Okay, whether there is depression, anxiety, panic attacks, etc., etc. To understand whether Majjava Srotas is functioning properly or not. We also understand the sleep patterns in the people to understand the Majjava Srotas functioning. We also understand the memory and intellect part of it to understand how the Majjava Srotas is functioning. Okay, as far as the Majjava Srotas explanation given in the textbooks is, you try and check whether the small joints are painful, which is mainly the main site of Majja, which is the bone marrow. Brahma means dizziness. Okay, Murcha means fainting. Brahma means dizziness. Murcha means fainting. Tamadarshan, we have already said, Tamadarshan is appearance of black circles or black spots in front of your eyes. That is what is Tamadarshan. Tama means black. Darshan means seeing those black spots or black circles. So that's Majja. But when I examine, I look at the psychological characteristics, I examine for the sleep, and I also look for basically if there is any challenges with the intellect, memory, grasping power, recollection power, etc. That is what I look at in terms of the Majjava Srotas and understanding of Majjava Srotas. Then Shukrava Srotas, infertility, lack of libido, these are two important things to study. Infertility, sterility, and lack of sexual stimulation, which is lack of libido. That is something that we study in terms of Shukrava Srotas. And today I would say that Shukrava Srotas problems are increasing very dramatically. They are increasing because of the bad lifestyle, because of the stresses, because of the emotional stresses that people are going through, because of the economic stresses people are going through. It is affecting the Shukrava Srotas drastically. That is why the infertility cases are also going up. You know, the number of infertility cases is on the rise because of the Shukrava Srotas being affected. The Shukra Dhatu is responsible for reproduction, and that is something that is to be studied whilst examining the person. Yes, Doreen?
Infertility comes from mostly all the medicines and all the food that has been like modified a lot. Mostly.
Sorry, can you repeat?
Don't you think that what? Infertility comes from mostly all the medicines and all the modified food.
So infertility, like I said earlier, is on rise because of the bad food habits, because of the bad lifestyle, and obviously because of the various stresses people are undergoing. Okay, that is there. Medicines, obviously, we can say, instead of saying medicines, we can say chemicals. You know, various kinds of chemicals and the toxins which are going inside the body. Those are also causing damage to the Shukra Dhatu, resulting into infertility or sterility. You know, those kind of problems. Sterility is basically problem with the male. Infertility can be a problem with both male or female, basically. You know? So where the female is not fertile, you cannot conceive a baby. That is what is sterility and infertility. So Kleibia refers to instability. Kleibia refers to sterility. Okay. It includes conditions like erectile dysfunction. It includes conditions like lack of complete desire or lack of stimulation, sexual stimulation. All that comes under Kleibia, which is the word used. And then lack of libido, lack of sexual stimulation, that can be in both the sexes, male as well as female. Then the Purishava Srotas, obviously noisy stools, painful stools, liquid stools, stools which are like having grathita, means like clotty, stringy stools, and atibahu is excessive quantity. All these different kinds of stools will indicate disturbances with the Purishava Srotas. Obviously, liquid stools, not well-formed stools, while stools, painful stools, while passing stools, you have pain, and excessive quantity of stools. All these are indicators that the Purishava Srotas is disturbed. So when we are looking for, or when we are examining the patient, we examine for the bowel movements. Okay, when we examine for the bowel movements, we examine whether they are regular, irregular. And along with that, we also examine for the consistency of the stools, the quality of the stools, whether they are well formed, whether they are liquid, etc., etc. So there you will find out all these signs and symptoms which will indicate that there are some problems with the Purishava Srotas. Then Mutrava Srotas. When you are examining the Mutrava Srotas, couple of things that you have to understand or ask for is the frequency of micturition, frequency of urination. Yes, Dekha. Sorry.
So just before we go to the Mutra, I was wondering still of the Shukravara Srota. Because it's we talked about the reproductive parts, but for example, cancer, would it be a Shukravara issue, or depending more or where it's located, it will be any other dhatu?
So Shukrava Srotas involvement will always be there with cancer. So when we talk of Shukra Dhatu, we talk of Shukra Dhatu, which is specific to the function of reproduction. Okay, which is related to your reproductive system. Okay, and then you talk about Shukra Dhatu, which is your Shukra Dhatu spread all over the body. which is responsible for reproducing each and every cell in your body. So there can be two types, or there will be two types of Shukra Dhatus that you will consider in your body. One is specific to your reproductive system, and other is specific to regenerative system. Now, for the regenerative system, obviously there is going to be Shukra Dhatu requirement in the body for the cell repair, cell regeneration, etc. So when the whole body systemic Shukra Dhatu, which is present in the entire body, there is disturbance with that, then that is going to result into a condition like cancer, which is growth of cells not being able to perform their normal function. So cells are being formed, but they are not able to perform their regular function is what is the underlying cause in cancer. So obviously the Shukra Dhatu is doing the function of creation, but the product that is coming out of that is not of a good quality. So the processing is not happening correctly. So the end product is not proper. And that is what is the condition in cases of condition like cancer. And we have to consider the element of Shukra Dhatu or the involvement of Shukra Dhatu in that. Okay. Now coming back to Mutrava Srotas, frequency of urination has to be asked, considered. Whether there is urination in the night has to be asked, because nocturnal urination is specific to diabetic patients. Overall, generalized increased frequency can directly be related to excessive fluid consumption also. Okay, so that is also checked. Then you also have to check the quality of urine, whether the urine is very strong, urine has any precipitates, urine has any deposits in it, is there any particular smell to the urine? All that has to be checked. Say urine has a sweet odor, urine has fruity odor, urine has strong odor. So all that has to be checked, because when we are checking Mutrava Srotas, there will be some or the other underlying cause which will cause these signs or symptoms to appear. There can be infection, there can be some kind of trauma, there can be some disturbance with the Mutrava Srotas which can cause these signs and symptoms. So asking for these various indicators which indicate towards the abnormality of the Srotas has to be checked. Svedava Srotas. Now here, obviously we'll ask for the sweating. So when we are checking for the sweating, whether there is excessive sweating, whether there is absence of sweating. And whilst checking the sweating, we'll also check whether that sweating has any particular odor, smell, tendency to cause staining, So the sweat will leave marks on the clothes, so it stains the clothes. All those will also be checked. So excessive sweating can be an indicator of increased Meda Dhatu, can be an indicator of disturbed Meda Dhatu. Bad, strong smell to the sweat can also be an indicator of disturbances with the Meda Dhatu. Staining caused by excessive sweating or staining caused by sweating can be an indication that the pitta is disturbed or the pitta is causing disturbances with the Svedava Srotas. So those you will have to check for it. And then the sweating will then give rise to the skin conditions also, which will be primarily like dryness of the skin or burning sensation of the skin, or the body hair falling off, etc. So those will be resultant of the sweating that is happening in the body. And then you will also understand the nidana, which is the causative factors. You will understand the purva rupa, which is the premonitory signs, the actual signs and symptoms, prognosis, whether what is the prognosis? Is the disease treatable, not treatable, easily treatable, difficult to treat, etc. And these are the various cause factors involved in the disease progression. You will talk about the doshas, you'll understand the doshas which are involved, you'll understand the dushya, which is the dhatus which are involved, you'll understand the agni involvement in that, you'll understand the ama involvement in that, and you'll understand the srotas involvement. So that is the general understanding of examination of the patient while studying the diseases. Okay, we'll take a break of 15 minutes and we will come back, and then we will start with the diseases.